Hello everyone and welcome to day 5 of our daily quiz series, and we are focusing on CVS and respiratory system this week. So let's have a look at the first question. The first question says, a healthy 35-year-old man hears the doorbell and suddenly stands up. So he goes from a lying to a standing position. And therefore what is going to happen? Because of the effect of gravity, there is going to be more peripheral pooling, and because there is a peripheral pooling of blood, this will decrease the venous return and therefore also decrease the cardiac output. Now, if the cardiac output decreases, this will result in a decrease in the blood pressure. So what will happen to the baroreceptors? Remember, baroreceptors are your stretch receptors. So if there is a fall in the blood pressure, there is a decreased stretch of the vessel wall and a decreased firing rate of the baroreceptors. And whenever there is a decreased firing rate of the baroreceptors, the effect on sympathetic is reverse, ulta. That means there will be increased sympathetic discharge and a decreased parasympathetic discharge. So increased sympathetic nerve activity definitely, and a decreased parasympathetic, right? Increased sympathetic and decreased parasympathetic means what is going to happen to the heart rate? There will be an increase in heart rate and a increase in the blood pressure. It helps to bring the blood pressure back to normal. Our baroreceptors are known as buffer nerves. They are buffering against changes in blood pressure. For example, this change in blood pressure due to change in posture. Now, what will happen to the RR interval? So when I say the RR interval has increased, that means the time between two R waves has now increased. That means this is the RR interval, the period between two R waves. If this is increased, means heart rate has decreased. So that is not a possibility. What is happening over here? The heart rate is increasing. Increased venous compliance. See, what is venous compliance? Now, compliance means distensibility of a vessel. So whenever I increase the sympathetic discharge, the smooth muscle of the veins will contract. There will be a venoconstriction. And this venoconstriction, in fact, reduces the ability of the veins to expand. So there will be a decreased venous compliance. So the answer to this question is an increased sympathetic activity. Extremely important concept. Baroreceptors are very frequently asked. Let's have a look at the next question. A 50-year-old patient presented with dyspnea and chest pain. Which of the following statements confirms the diagnosis of aortic stenosis rather than aortic regurgitation in this patient? This is a NEETPG 24 question. Now, aortic stenosis causes a reduced pressure at the aortic valve? No, in fact, it causes an increased pressure. So this is not the answer. Increase in work done by the heart does not contribute to increased myocardial. No, that is not possible. More the work done by the heart, more will be the myocardial oxygen consumption. What is the work done by the heart? Work done by the heart is stroke volume into the mean arterial pressure. Let's look at the next third option. AS causes a larger increase in preload. No. What is preload? Preload is the end diastolic volume. What is going to cause an increase in preload is AR. AR, because of aortic regurgitation, blood goes back into the left ventricle, increases the end diastolic volume. So this increases, AR increases the preload. AS will increase the afterload. What is afterload? The load against which the heart has to contract. So if it is a stenosed aortic valve, the heart has to contract with more force, increasing the afterload. So AS increases the afterload, AR increases the preload. So this is also not the answer. Increased myocardial oxygen consumption is seen more with increase in pressure work than with volume work. This is true. What is volume work? If there is increase in stroke volume, we say there is increase in volume work. For example, in a patient of aortic regurgitation. If there is an increase in the mean arterial pressure, we call it an increase in the pressure work. So the myocardial oxygen consumption with increase in pressure work is more than with increase in volume work. The next question. A 24-year-old woman presents for an annual checkup to a family physician. While auscultating her heart sounds, he instructs the woman to take a deep inspiration. During this maneuver, he detects a splitting of the second heart sound. Which of the following is a physiological basis of splitting of S2? Now, what happens to S1 and S2? Now, as far as S1, onset of systole, and onset of diastole. Now, S2, normally it is a split sound. Why? Because the aortic and the pulmonary valves do not close at the same time. During inspiration, this gap between the closure of the aortic and the pulmonary valves increases. So the splitting increases during inspiration. Now, why does this happen? So during inspiration, there is going to be more blood flow to the right side of heart. There is increased blood flow to the right side of heart. Now, why does the blood flow increase to the right side? Let's try and understand this. The reason why there is increased blood flow is, number one, the intrapleural pressure becomes more negative during inspiration. And when it becomes more negative during inspiration, it has a suction effect on the extrathoracic veins. Literally, it is something like when you're drinking Pepsi or Coke with a straw, you're creating a negative pressure that causes a suction effect on the soft, whatever you're drinking, right? So something like that. The intrapleural pressure is becoming more negative, so literally has a suction effect on venous return. The thoracic veins distend, so their pressure lowers. So the pressure gradient between the extrathoracic and the thoracic veins increases. So causes more blood flow to the right side of heart. Then during inspiration, the diaphragm contracts and moves downwards. When it contracts and moves downwards, it increases the intra-abdominal pressure. And this increase in intra-abdominal pressure will compress the abdominal veins and increase the venous return. So when I have more blood flowing to the right side of heart, that means more blood into the right atrium, right ventricle, and into the pulmonary circulation. This delays the closure of the pulmonary valve during inspiration. So this is the reason why, as you can see over here, the closure of the pulmonary valve is delayed. That increases the splitting of the second heart sound during inspiration. So answer to this question will be a delayed closure of the pulmonary valve. Now, what is going to happen to the aortic valve? Now, during inspiration, there is in fact a less blood flow to the left side of heart. And the reason for this is, during inspiration, intrapleural pressure is becoming more negative. So it tends to distend the pulmonary veins. These pulmonary veins which drain into the left atrium will now distend and hold more blood. So decreased flow to the left side of heart. Decreased flow to the left side of heart will now cause an early closure of the aortic valve. But this is, please remember, a minor effect. Major effect is this delayed closure of the pulmonary valve. Now, because there is less flow of blood into the left side of heart during inspiration, there is less left ventricular filling, less left ventricular stroke volume. There is a fall in the blood pressure during inspiration. The systemic blood pressure falls, but this fall is usually less than 10 millimeters. If the fall is more than 10 millimeters, we call it pulsus paradoxus. And which clinical condition, pulsus paradoxus, is a diagnostic feature? Cardiac tamponade. So answer to this question is D. Delayed closure of the pulmonary valve, that is the major reason. Minor reason is an early closure of the aortic. Let's have a look at the next question. Maximum CO2 transport in venous blood occurs as which of the following? The maximum CO2 transport will be in the form of bicarbonates. CO2 is transported in 3 forms. Maximum as bicarbonates. Number 2, in combination with hemoglobin to form carbamino compounds. And number 3, as dissolved carbon dioxide in plasma. Carboxyhemoglobin is carbon monoxide plus hemoglobin. Carbon dioxide plus hemoglobin forms carbamino compounds. A 35-year-old soldier sustains a bullet wound to the chest that causes a pneumothorax. Which of the following will be seen in this patient? Now, lungs, as you know, are enclosed by a double-layered pleura. Now, the elastic recoil of the lung is towards the inside, which is called a collapsing force. What is this? This is the elastic recoil. What is recoil? When you stretch a rubber band, there is a tension which is generated. When you leave it, it will recoil to its original size and shape. The lung has got elastic fibers. So the tendency to recoil is towards the inside, which is called the collapsing force. Similarly, the chest wall also has elastic fibers, and their tendency to recoil is towards the outside, which is called an expanding force. Now, these two forces are opposing each other. And these two forces, remember, are equal and opposite at FRC, functional residual capacity, which is the lung volume at the end of normal expiration. Right? Now, when there is a bullet wound and there is a pneumothorax, this link between the two forces is broken. So what happens to the underlying lung? Tends to collapse. What happens to the chest wall? It tends to spring outwards. So chest wall has a fuller appearance, but the lung inside may be collapsed. So there is a decreased lung volume. Thoracic volume is increased because, like I said, the chest wall tends to spring outwards. Intrapleural pressure in a pneumothorax, normally this pressure is negative. But in a pneumothorax, when air comes from outside to inside, this pressure becomes 0. So this pressure, in fact, increases. 0 means it's equal to the atmospheric pressure. Normally, it is less than atmospheric pressure. So the intrapleural pressure does not decrease. In fact, it increases and becomes 0, equal to the atmospheric pressure. There is a decreased elastic recoil of chest. No, there is an increased. That is why the chest gets a more fuller appearance. So these were today's questions. See you tomorrow.